Medication errors can cause inappropriate medication use or patient harm and mostly occur at transitions between caregivers, such as at admission, transfer, discharge, or moves to different floors. Nurses, just like us, can make these errors if we are not careful, especially without doing an adequate reconciliation. So it's up to us. Are we going to do a med rec or are we going to cause a med rec? The first thing we as nurses want to do when obtaining a medication reconciliation is obtaining a comprehensive and current list of patients' medications whenever a change in healthcare setting is done, such as admission, transfer, and discharge. This will include all current prescriptions and over-the-counter medications, as well as herbal supplements. Next, we would review what the patient was taking at home or prior to admission and make sure the list of medications, dosages, and frequencies are accurate. Compare this list to current ordered medications and treatment plans to ensure accuracy. You may want to include a family caregiver in this discussion if it is appropriate. Third, we would want to reconcile. Compare new medication orders with the current list, investigate any discrepancies with the patient's healthcare provider, and document changes in medication. Lastly, we would want to ensure that all patients' healthcare providers have the most updated list of medications. You want to communicate and verify changes in medications with the patient as well. During medication reconciliation, we as nurses are responsible for comparing any prescribed medications with orders that have been prescribed previously. Through this process, the nurse will identify and resolve orders that are duplicated or any that should be omitted. Nurses also evaluate the risk of any unintended medication interactions. Maintaining an accurate list of medications provides quality patient care and ensures safety of the patient. While reconciliating, be mindful of distractions and clarify any questions that you may have to provide an accurate medication list. After reconciliation, consultation with fellow members of the patient's team is necessary to provide them with an adequate medication list. Our goal as nurses is to provide a safe outcome and quality patient care for each patient we come in contact with from admission to discharge. That's why medication reconciliation is in place to begin with. This is extremely important as a patient is being discharged because we as nurses could be the last line of defense to a medication error. A method for discharge medication reconciliation was developed by nurses to ensure safe transition of care and improve patient outcomes. The discharge timeout process has empowered nurses to take a more active role in discharging their patients and has fostered a more collaborative relationship between nurses and physicians. Successful transition to home depends on accurate, complete medication reconciliation for patient safety across the continuum of care. Through the implementation of a timeout, nurses can ensure patients are discharged to home with the correct medications list, thereby improving the transition in care. The discharge timeout process was modeled after the operative timeout process used to ensure patient safety to a surgical procedure. Nurses describe this timeout process as a win-win for patient safety and time management. Medication reconciliation. Ask your patient a variety of questions to help better understand your patient's current medication regimen and to better grasp their understanding of the medications that they are taking. So today, I hope by this public service announcement you have learned how medication reconciliation can help you provide safer quality care to each of your patients. To recap, nurses play a vital role in improving the safety and quality of patient care. Safe care transition requires a systematic approach including medication reconciliation, structured discharge, communication, and patient education. And remember, medication reconciliation can save lives.